at 65, you're going to sign one piece of paper that could cost you $100,000 or protect you from financial ruin in retirement. And the terrifying part? Most people have absolutely no idea which choice they made. I'm talking about the decision between Medicare Advantage and Medigap. Last month, my mom called me. My dad, after 2 years fighting vascular dementia, needed to change his coverage. Simple, right? Wrong. What I discovered in the next 72 hours made my stomach drop. My parents almost made a catastrophic mistake. And millions of Americans are making this same mistake right now. Here's what nobody tells you. Once you choose, you might be locked in forever. The insurance companies know this. The brokers know this. But you? Probably not. Until today. I'm Erin, and the next 12 minutes might be the most important thing you watch before turning 65. Let me show you what's at stake with 2 real scenarios. Susan chose Medicare Advantage at 65. 0 premium, free gym membership, dental included. For 10 years, she paid almost nothing. Then at 75, she got cancer. Suddenly, she's hitting her $7,500 out-of-pocket maximum every single year. Her oncologist leaves the network. Every scan needs prior authorization. Treatment gets delayed. She tries to switch to Medigap for better coverage. Denied. Her cancer, the very reason she needs better coverage, is now a pre-existing condition. No Medigap company will cover her. She's trapped. Tom, her neighbor, paid $200 a month for Medigap from day one. His cancer treatment, fully covered. Any doctor, no delays. Total out-of-pocket for his cancer year? About $2,500 in premiums. Same diagnosis. Completely different outcome. The only difference was a decision they made at 65. Quick foundation before we go deeper. Even if you think you know this, stay with me. When you turn 65, you get Original Medicare. 2 parts. Part A covers hospital stays, free for most people if you paid Medicare taxes. Part B covers doctor visits and outpatient care, around $175 per month in 2025. Here's what shocks people. Original Medicare only pays 80% of costs. You owe the other 20%. Think that doesn't sound bad? Do the math. Heart bypass surgery costs $150,000. You owe $30,000. Cancer treatment hits $200,000. You owe $40,000. And there's no annual maximum. That 20% is unlimited. This is why almost nobody stays on Original Medicare alone. You need additional coverage. You have exactly 2 real choices. Door number 1, Medicare Advantage. Door number 2, Medigap. Choose wisely. Because once you walk through one door, the other might lock behind you. Here's why 54% of Americans choose Medicare Advantage and why insurance companies spend billions advertising it. Medicare Advantage replaces Original Medicare. A private company takes over. Medicare pays them a fixed amount. They make the rules. The pitch is obvious. 0 monthly premium beyond your Part B. Everything bundled. Drugs, dental, vision, hearing, gym memberships. An out-of-pocket maximum, usually $3,500 to $9,000 per year. One plan, one card. Simple. Sounds perfect. Here's what the commercials don't show you. Hidden cost number 1. Copays add up fast. Specialist visit runs $40 to $50. ER visit is $90 to $150. Hospital stay costs $200 to $400 per day. One bad health year, and you're hitting that maximum fast. Hidden cost number 2, network restrictions. Your doctors must be in-network. Networks change every year. Your cardiologist of 10 years could be out of network next January. You'll find out in October. Hidden cost number 3, prior authorization. Need an MRI? Get approval first. Surgery? Approval first. Studies show prior authorization delayed cancer treatment for 1 in 4 patients. When you're sick, the last thing you need is fighting with insurance. The honest reality. At 65 and healthy, Medicare Advantage is often cheaper. At 75 and sick, Medicare Advantage can become a nightmare. And switching. That's the trap we need to talk about. Medigap gets zero sexy commercials, no celebrity endorsements, no free gym memberships. There's a reason for that, and it's not what you think. Medigap works alongside Original Medicare. It doesn't replace it. It fills the gaps. Here's the flow. You get care. Medicare pays 80%. Medigap pays most or all of the remaining 20%. You pay little or nothing, predictable costs. Your monthly premium is your cost. No surprise bills, no maximums to hit. Total freedom, any doctor, any hospital, any specialist, anywhere in the country. As long as they accept Medicare and over 90% do, you're covered. No networks, no referrals, no prior authorization. Your doctor orders a test, you get the test. No waiting, no fighting. The trade-off is real. Medigap costs more up front. Typical premiums run $100 to $350 per month depending on your age and location, plus a separate Part D drug plan. At 65 and healthy, this feels expensive compared to $0 per month. But here's the math nobody does. In a healthy year, Medicare Advantage costs you around $500 total. Medigap costs around $2,500 in premiums. Advantage wins. But in a major illness year, cancer, heart surgery, serious rehab, Medicare Advantage hits $6,500 to $8,000 or more. Medigap stays around $3,000. Medigap wins by thousands of dollars, and the older you get, the more likely you are to have that bad year. This is the most important part of this entire video. Don't look away. When you first enroll in Medicare Part B at 65, you get a one-time 6-month window. During this window, you can buy any Medigap policy. No health questions, no medical exam, no denial for pre-existing conditions. This is called Guaranteed Issue Rights. It's your healthcare golden ticket. For most people, it never comes back. Here's what happens if you chose Medicare Advantage at 65 and want to switch later. You apply for Medigap. They do medical underwriting. They see your diabetes and heart condition. Then one of three things happens. Outcome A, denied. We can't offer you coverage. Outcome B, rated up. We'll cover you for $450 per month instead of $200 per month. Outcome C, exclusion. We'll cover you, but not for anything heart-related for 12 months. The sicker you get, the more you need comprehensive coverage, the harder it becomes to get it. You are locked in forever. There are limited exceptions. If you joined Medicare Advantage when first eligible and switch back within 12 months, you keep guaranteed issue rights. A few states like New York and Connecticut have stronger protections. But for most Americans, the window closes and doesn't reopen. Here's the critical thing to understand. Going from Medigap to Medicare Advantage is almost always possible. Advantage plans generally don't do medical underwriting, but going from Medicare Advantage to Medigap, often impossible after health problems develop. This is a one-way door, and millions of people don't know it until they're standing on the wrong side. Stop overthinking. Answer 5 questions honestly. 1. What's your risk tolerance? Pay less now with higher risk later. Lean toward Medicare Advantage. Pay more now for predictable costs no matter what. Lean toward Medigap. 2. How important is doctor choice? Flexible with networks. Advantage works fine. Want any doctor, any specialist, no restrictions. Medigap. 3. Do you want to fight insurance companies when you're sick? If you can handle prior authorizations, Advantage is manageable. If you don't want that fight when you're dealing with cancer, Medigap. 4. What's your health trajectory? Healthy family history and low risk. Advantage is reasonable. Conditions developing or family history of major illness. Medigap provides protection. 5. Are you thinking 10 to 20 years ahead? This is the big one. Don't just ask what's cheapest right now. Ask what you want at 75, 85, and 95. Choose Medicare Advantage if your budget is tight, you're healthy and low risk, and you understand you might be locked in. Choose Medigap if you can afford higher premiums, you want zero surprises, and you're planning for your older years, not just right now. Here's what to do right now. Approaching 65? Mark your calendar. Your 6-month Medigap window starts when Part B begins. Know that date. Get quotes for both options. And talk to a fee-only fiduciary advisor, not a commission-based broker. Already on Medicare Advantage? Check if you're within your 12-month trial period. If you've had health issues and can't switch, learn to maximize what you have. Navigate networks, fight prior authorizations, understand your appeals rights. Already on Medigap? Stay put unless finances are desperate. That coverage is gold. At 65, you're making a decision for the 85-year-old version of yourself. That future you might have cancer, might need heart surgery. Make sure they're grateful you planned ahead, not trapped in a system they can't escape. Drop a comment below, Medicare Advantage or Medigap, which are you leaning toward and why? I read every single one. If this video helped you, hit like. It helps YouTube show this to people who need it. And if someone you love is approaching 65, share this with them. You might save them from a decision they can't undo. Subscribe for more retirement planning content every day. Until next time, plan smart, live well.